Are you on Sertraline? Well, in this video, we're going to be talking about the 5 things that you need to know about Sertraline. So number 1, what is Sertraline? Well, Sertraline, also known as Zoloft, is a selective serotonin reuptake inhibitor, and basically it blocks the reuptake and release of serotonin in our brains, increasing the level of serotonin that we have, which in turn helps boost mood, keep you calm and relaxed, and promotes good sleep. It has 6 FDA-approved indications. That's right, 6, the most of all of the SSRIs and antidepressants for that matter. And only 2 of them are actually for depression. That's major depressive disorder and premenstrual dysphoric disorder. The other 4 are anxiety disorders, such as OCD or obsessive compulsive disorder, panic disorder, post-traumatic stress disorder, and social anxiety disorder. So I like to use Sertraline for those patients who have a mix of anxiety and depression, but where anxiety tends to be the dominating symptom because Sertraline has those 4 indications for anxiety disorder. Number 2, what are the side effects? Yeah, all medications have side effects, and Sertraline is no exception. The most common side effects that you'll experience are going to be nausea, a little bit of stomach upset, headache, dizziness, or some people will feel really tired with the medication or sleepy, so just take it at night if that's you. Or some may have some activation or feel a boost of energy, so you take it in the morning. Now, just so you know, those side effects will typically only last for 1 week. So hang in there, and it's actually a sign the medication is working because we actually have and make a lot of serotonin in our gut. That's why you get butterflies in your stomach when you're nervous. So it's a sign the medication is working. After your body gets used to the medication and adjusts to it, those symptoms typically will resolve on their own. So stick with it. If you're on day 2 and you're feeling a little nauseous, don't give up. Give it a good week and continue taking it. It's a sign it's working. Which takes us to number 3. How long does it take for it to actually start working? Well, let me be real with you here. Sertraline is not a miracle drug. You don't take the medication and then voila, everything is in rose-colored glasses and your mood is all of a sudden changed. It doesn't work that way. Actually, it's going to take anywhere from 2 to 8 weeks. And typically, 4 to 6 weeks is the duration where most people will start to feel the effects or feel the benefit of the medication. So I like to start patients on a low dose of Sertraline just to get their body used to it and tolerate it. See you back in 1 month. See how you're responding to the medication. If you're not yet responding, but you're tolerating it well, then we'll increase the dose. Come back in another month, which will be 8 weeks, and by then you should notice a difference. If not, then it's time to switch you to something else. But again, that's something that you need to discuss with your mental health care provider. Which takes us to number 4. Well, how long do I have to take it for? Well, that depends. Typically, you're going to take this medication, whether it's for depression or anxiety, anywhere from 6 to 12 months. And that's something that you and your provider will have to discuss and determine when is the right time to start coming off of the medication. However, about 25% of patients who have depression or anxiety will have a chronic course of depression or anxiety and need longer-term treatment. So this is case by case, and this is something that you will have to determine with your provider. But typically, if this is your first bout of depression or anxiety and your first time taking Sertraline, it's typically going to be anywhere from 6 to 12 months after your symptoms have resolved. Which takes us to our last tip or last thing that you need to know about Sertraline. Number 5. Can I just stop taking sertraline on my own? No, this is not advised because though sertraline does not cause dependence or addiction, if you abruptly stop taking it, it can cause a withdrawal or discontinuation syndrome, which can cause nausea, tremors, feeling dizzy, muscle weakness, and muscle pain. It can also cause brain zaps or feeling like electricity is running through your brain. So you don't want to stop this abruptly on your own. You want to talk to your mental health care provider so you can slowly and safely taper off of sertraline. So, are you taking sertraline? If so, please leave a comment below about your experience with the medication and if there's any questions that you have that we didn't cover in this video. Or are you taking another medication and want to learn more about that? Put that in the comment section as well so that we can cover more medications that are important to you. I thank you for watching and I'll look forward to seeing you next week.